Hello, Elevation Health family and friends. This is Dr. Dave Yachter. Today we're talking about our condition of the week, which is neuropathy. Very, very common condition. Some surprising statistics about neuropathy. About 30 million Americans suffer from some type of neuropathy. Now, there can be a lot of different causes for neuropathy, some because of diabetes, some because of chemotherapy, AIDS. There are other causes, and some of these causes come under the heading of idiopathic, which means that there's an unknown cause. They don't know where it comes from or what is causing it. There are other immune disorders such as Guillain-Barré syndrome, Charcot-Marie-Tooth, celiac disease, lupus, rheumatoid arthritis, as well as shingles can all be causes for neuropathy. And the symptoms of this type of neuropathy are very wide ranging. Sensations of wearing a glove or a sock, very, very strange feelings on your hands or feet. Also, burning sensations or freezing type of pain. Sharp, jabbing, shooting, or electric type pains are very sensitive. Extreme sensitivity to the touch is probably the most common symptom that we see with neuropathy. And difficulty sleeping because of the foot and leg pain. Loss of balance and coordination is very common, in addition to muscle weakness, cramping, or twitching. And very often we'll see difficulty with a patient walking or moving their arms or legs as a result of the pain from the neuropathy. What causes peripheral neuropathy? It can be a number of different causes, but something that in particular puts stress on a nerve for a long period of time, like a job or a hobby, it really increases the chance for the development of this type of problem. Playing certain sports or musical instruments can be a causative factor, or using vibrating mechanical tools or even crutches can put pressure on these type of peripheral nerves and cause irritation or damage. Sometimes excessive drinking of alcohol can affect the nervous system in a particular way, which causes numbness of the hands and feet. And another well-known cause of peripheral neuropathy is a vitamin deficiency, in particular B vitamins. A lack of B1 and B12 in particular makes peripheral neuropathy much more likely. And finally, toxicity is definitely a causative factor for peripheral neuropathy, where there's exposure to heavy metals like lead, mercury, arsenic. These types of heavy metals are well-known cause as far as nerve pain goes and can wreak havoc with a person's health. So when it comes to managing the type of pain that we're talking about with neuropathy, it really depends on the individual, the case, the symptoms, the severity, and the true underlying cause of where it's coming from. Medical doctors usually treat nerve pain and other symptoms like this with acetaminophen or non-steroidal anti-inflammatory medications, NSAIDs. At first, try something conservative. Sometimes the next step is the prescription of antidepressants or anticonvulsant medications such as gabapentin, better known as Neurontin, or Lyrica, which, by the way, come with the risk of serious side effects like violent behavior, aggressiveness, anger, anxiousness, or restlessness. Also, well-known side effects of these medications include depression, panic attacks, suicidal thoughts or behavior. And if the neuropathy is caused by a spinal problem, such as a herniated disc, a doctor might want to recommend epidural injections. And that may provide relief for about 50% of the time at best, and typically needs to be repeated at least once a year when the effect of the shot wears off. In some cases, nerve decompression, surgery or discectomy or laminectomy might be recommended. But what I see that with that as a chiropractor is once you do that and there's a lack of mobility at one particular level in the spine, it starts to put stress on the vertebrae above and below. And it accelerates the degeneration and deterioration of the adjacent segments. And so, you can, in one sense, short-term get relief with surgery sometimes, not all the time. In fact, what I usually see is people are worse off after their surgeries. It's very, very unlikely and uncommon that I've seen in a lot of the cases that I've dealt with where the people were better. but it also causes other problems at other levels in the spine, and it never corrects the cause, the source, and the root of it. So in some cases, in extreme situations, there may not be another option. But if you catch these things early enough, very often there are other conservative options that may be available. We know that acupuncture in many cases is effective. And we also know that chiropractic care can be effective in many of these cases. As chiropractors, you know that that's what we're working with. We're working with nerves. Anytime we can move a bone off a nerve in the spine, it not only has a local effect, it has a peripheral effect. If the spine is shifted out of alignment, we call that a subluxation. If it puts pressure on the nerve, we call that a subluxation, especially if it's interfering with normal nerve supply as the brain tries to communicate through that nerve to all the cells, organs, and tissues in the body. So in one sense, it may be causing pain. In another sense, it could be causing and leading to other health problems. For example, the nerves in your arms not only bring the feeling and function to your hands and the strength and energy there, but those are also the same nerves that go to your heart, your lungs, your thyroid, and other important organs. And so it's not uncommon at all. If you have a problem there, left uncorrected, it leads to shortness of breath, chest pains, cardiovascular issues, and it can be a source of significant health issues. Yes, when you have subluxation, when a bone's out of alignment long enough, it can wreak havoc on an individual's health, let alone cause neuropathy. So I have several patients, many patients, where they'll come in. I remember a lady came in not too long ago, and she was having trouble walking because of the diabetic neuropathy on her feet. She was unable to wash her feet. She was unable to even walk from a sofa in her living room to the restroom, to use the restroom. So she was pretty much housebound. And one of her friends referred her to our office. We examined her spine. We did find multiple levels of subluxation, especially in her lower back, where the nerves were feeding out to her lower extremities. And I started to work on that, not to treat her neuropathy, but to correct the cause, the source, and the roots of where the nerve interference was, which was in her lower back. So as a result of correcting those subluxations, taking the pressure off the nerves, what happened? Her body started to heal itself. All of a sudden, she started getting these pins and needles. And she was asking me if that was normal. I said, well, did you have it before? She said, no. I said, well, it's almost like if you are sleeping on your arm and then you get up and then all the sensation is starting to return to your arm. Usually that's a sign of your body starting to, the nerve starting to regain sensitivity and function properly. I said, let's give it some time. Well, a couple of days went by and she reported that not only did the tingling go away, but she started to get more strength in her legs, and the burning was not in her feet anymore, and she could actually wash her feet. A couple of days later, she went with her daughter to the mall, and she started walking around the mall. She hadn't been able to walk in the mall for months and months and months, and this was a lady on 13 different medications. Before you knew it, she was already reducing and getting off many of those medications. She was starting to live her life normally, didn't have the burning pain anymore, didn't have the peripheral neuropathy pain anymore to the extent that she had it. Was she perfect? No, but she was a lot better, and her quality of life had improved significantly. Again, this is just one example of many after many years of practice where I'm not treating a person's condition, in this case, neuropathy. No, I wasn't treating a neuropathy or a diabetes. I was correcting subluxations. I'm moving the bone so the body can do the healing, removing the interference. The body doesn't need any help. It just needs no interference. And the power that made your body can then start to heal your body. It's just a matter of finding and removing the interference so that your body can start regaining function and healing the way it was designed to. Very, very simple concept. It's a principle. It doesn't change. And I always look at that, and I always use that as my yardstick as to how well a job I'm doing when I'm taking care of my patients, when I'm taking care of you and your family. So subluxation as a cause, whenever there's an issue, whenever there's a health problem, I always look for subluxations as the cause. There are many different causes or causative factors for the disease, but there is nothing more effective than correcting subluxations, than removing interference to whatever the condition is in the body, it will always do better with better nerve supply. So, the question always is, who do you know suffering with this? Anybody that you know with any type of neuropathy or these types of health conditions? Because if you know something, especially if you're learning and following along with these segments, say something, because you can make a huge difference in someone's life. So I encourage you to do that. Thank you so much for joining me today. I love and appreciate you. God bless.